The prison industrial complex in America has the largest clusters of COVID-19 cases. Prisoners are having a problem getting legal redress for getting released, and there's a racial disparity in the amount of COVID-19 cases that's in prisons that's impacting Black and Brown communities. So joining me today to discuss the legal situation and the racial disparity is Professor Lance Brown and ACLU staff attorney Andrea Woods. Thanks for joining me.
Thanks for having us.
Okay, I would like to start off with you, Andrea. You have been fighting this fight uh, on behalf of prisoners through the ACLU. What has happened is there's all these procedures that prisoners must go through before they can file a legitimate lawsuit. Is this hampering the ability of people that are in jeopardy, like senior citizens and people with healthcare problems, to get out? What's the status? What's the situation with that right now?
So you're absolutely right. Unfortunately, incarcerated people face a number of barriers to having their rights vindicated, to getting heard by our justice system. You mentioned all the hurdles of exhausting, right? The Prison Litigation Reform Act, passed by the federal Congress, which the federal Congress incidentally could repeal anytime, requires that incarcerated people, no matter where, a county jail all the way up to a federal prison, have to essentially take up their grievances with the people who are incarcerating them. And what that looks like in practice is a tedious process of finding the right form, which guards are often unable to locate or unwilling to give. It means waiting and giving the entity incarcerating you time to respond, and that can take weeks or months. In the federal system, even if it went as fast as possible, an incarcerated person would have to wait 4 or 5 months before every appeal could get heard. And obviously, in the course of a crisis like COVID-19, which we all know spreads rapidly, particularly in congregate environments like jails and prisons, that's just not enough time. People need to be heard immediately to have their rights, even have a chance at having their rights vindicated. So it has been a barrier. I will say there have been mixed success, and really what that comes down to are the judges in this country. There are some judges who are willing to see that making somebody who has an underlying health condition or who is over 65 years old wait that long could be a death sentence. But there are judges who don't appreciate what a desperate circumstance somebody incarcerated is in the face of a crisis like this. And those judges have found every excuse to not hear the merits of people's case. And that includes by leaning on prohibitive doctrine like the Prison Litigation Reform Act. So some judges have done the right thing, and they have recognized that making someone wait that long is just no justice at all. But unfortunately, some others, including a lot of our courts of appeals, which was just the subject of the vice presidential debate last night, have been packed by ideologues, by President Trump and Mitch McConnell. A lot of those judges have, with some cowardice, I would say, upheld these really rigorous protocols that make no sense in the face of a pandemic like this.
Lawrence, can you talk a little bit about the disparity of healthcare, but in the Black community as opposed to other communities, and how that is impacting prison health?
Yes, well, America is extremely segregated. I call it, and other scholars call it, American apartheid. So you have a situation where many cities where incarcerated people come from, they're coming from hyper segregated spaces. and Black prisoners in particular, coming from red-line communities that have been starved of resources for decade after decade. And so, they're coming from these communities that have inferior health care. They may have hospitals that are there, but not the equitable amount of healthcare clinics, not the equitable amount of physicians who can practice and provide care in these communities. And when you get to the prison industrial complex, when you get to the places where people are incarcerated, you end up with prisoners that are disproportionately African American, disproportionately people of color. And so this virus, which does not discriminate, once it gets in the air, it's going to disproportionately impact the disproportionate population of people that are incarcerated in those facilities. So COVID is having a devastating impact in many prison facilities, particularly when you think about the way in which, just think about how people are packed in close proximity together. This is a virus that loves close proximity, and that places so many prisoners at risk.
Okay, Andrea, one of the things that the ACLU do is that it certainly does class action suits against governments and institutions. Is it possible to have any prisoner successfully met all of those criteria in which they can go to court? And if so, is it possible to use that case or those cases to do a class action suit against government officials, as opposed to trying to do case by case?
Yeah, thank you so much for that question. You're absolutely right. We are in the business of bringing class action lawsuits against government abuse of people's rights, and that's exactly what we've done in response to this crisis. So since March of this year, the ACLU has filed dozens, I think over 30 lawsuits against the Bureau of Prisons, county jails, all across the country. We've sued in federal court where we are subject to the barriers we were talking about earlier, and we've also sued in state Supreme Courts, which have a bit more power to just step in and act. Like I alluded to earlier, it's been a little bit of mixed success, and a lot of that really comes down to judges' mentality, judges' appreciation of these issues. Unfortunately, a lot of people who sit on the bench in this country are former prosecutors or former corporate attorneys. They're overwhelmingly white men. And that just all stacks up to it being a lot harder and harder than ever these days for people to get a court that's going to understand the full range of what's at stake here. All the issues that Professor Brown mentioned, I don't think our courts always really get it. But I will say there have been some success stories. And I think what is the most important to emphasize is that incarcerated people who are stepping forward, putting their name on these lawsuits on behalf of themselves and others, at risk to themselves. We know how prison and jail officials can operate, and unfortunately, sometimes people are retaliated against. Thanks to a lot of people stepping forward, there have been some successes. Usually at the lower courts. So we've seen courts enter injunctive orders requiring jails to provide better access to soap, masks, better social distancing practices. Social distancing in a jail or a prison is basically impossible if the jail or prison doesn't make it a top priority, make it possible for people to keep themselves safe. But we have had a number of successes where courts recognize that and order the people administering an institution to do better. The unfortunate side of the story is, again, that the higher courts have been pretty dismissive of really detailed hard work and brave advocacy by incarcerated people. One example that I want to just highlight, because it's happening in real time right now, there's a prison in southern Texas. It's a geriatric prison, so it disproportionately people who are older or who have health issues. And they filed a lawsuit in March or April of this year. And they just this summer had an 18-day trial. The court heard all kinds of heartbreaking evidence about people who require use of a wheelchair and who are blind serving as the janitors for their ward. They can't see what they're cleaning. This man testified, I can't even see what I'm supposed to clean, and yet I'm the one in charge of helping everybody stay safe by cleaning this space. These are the kinds of things that the folks administering jails and prisons do every day out of the public eye. And the court found that all amounted to a violation of the constitutional rights of the people incarcerated, the people who are disproportionately at higher risk of having a serious illness if they get COVID-19, and of course, by virtue of being in this environment, at a higher risk of contracting it to begin with. So the court issued an 84-page opinion explaining all the ways that this prison had gone way outside the bounds of reasonable safety, which it's obligated to provide. And so it was a great victory for those people, for their attorneys, and days later, a 3-judge panel of the Fifth Circuit, without any reasoning, without any evidence, put pause on that entire order. So that the story's not over. They'll have to continue to fight on the merits of their constitutional rights, their rights to be free from discrimination based on disability. I hope that story's not over, but it's just a great example of, unfortunately, a lot of courts are not interested in applying the facts and the law the right way. They're just sidestepping this really important crisis.
Lawrence, that brings me to an important question for you. There's been a number of riots, disturbances, and disruptions in various prisons all over the country, in the South included, as a result of them allowing COVID-19 to spread, or either transferring prisoners that tested positive into sterile environments and putting them with prisoners that was not infected. Is there something the public, and primarily, and I hate to say this, but it's true, a lot of these cases are prisons that have massive Black populations. Is there something the public can do beyond going to the court systems? Is there another way to address this? Or how should we be looking at this?
Well, I think, I want to start with the fact that you have a situation where prisons in the Deep South have had, and outside of the Deep South, have had tremendous outbreaks. Looking at Lincoln County, Arkansas, the Cummings unit, looking at Trousdale County, Tennessee, the Trousdale Turner Correctional Center, Bledsoe County Correctional Facility in Tennessee, the Marion Correctional Institution in Ohio, the Pickaway Correctional Institution in Ohio as well. These are places where Black prison population is either 40% to 50%, in states that are roughly where the Black population is maybe only 20% or so. So there's the disproportionality. But then you also have the other half that's often white. So white prisoners are being impacted as well. It's just not at as high of a rate. So I think these are prisons where early in the pandemic, I looked and I was trying to see what are the areas that have a high level of COVID. And it kept showing up in these rural counties. I'm like, well, what's going on in these rural counties? Lo and behold, they're the places where these incarcerational facilities are located. And so you have to remember, it's not just the prisoners. You have correctional officers that come in and out of those facilities. So they can bring it into the prison and they can take it out of the prison. So it really becomes a community-wide situation where, to your question, what can people do? People can appeal to city officials, county officials, state officials, and then of course vote in the upcoming election to make sure that there are people in place who understand the public health ramifications, that it's not just something that is somehow going to just stay inside the prison. People come in and out of the facility, so they can bring COVID in, they can take COVID out. And so communities need to really be concerned that these correctional facilities are oftentimes, havens, hotspots for COVID-19. And if it's a hotspot in the facility, bear in mind, it can definitely be a hotspot in the community without the right public health protocols in place.
Can I just add briefly to that, if you don't mind? Because that's exactly right, and it's so important. Epidemiologists and public health officials are unwavering in exactly what Professor Brown just said, and unfortunately, it has borne out in reality. We did not have to have as bad of outcomes in this country, but because of our mass incarceration crisis, we did worse, right? 88 of the top 100 clusters of COVID-19 in America are in jails, prisons, and correctional detention centers, excuse me. All of the top 16 are correctional environments. And unnecessary infections and deaths across the community, just as Professor Brown said, have happened. And it just didn't need to be this way. So I just wanted to really appreciate that point that you just made.
Absolutely. And I'll come back and say that, at its height, New York City, New Orleans, they both topped out around 2,000 people per 100,000 cases of COVID-19. Well, the prison populations I've named, they were at 3,000, 4,000, 5,000, 6,000 cases per 100,000 if you did the calculation that way. So the rate was 2 to 2.5 times higher, astronomically higher than the cities that had the highest rate of COVID during the early portion of the pandemic. So I think that speaks to the epidemiology that Andrea just really laid out in terms of the top spaces where COVID-19 has hit America. They're in the incarcerated facilities. So mass incarceration really has slammed America, is coming to bite us in the rear.
Andrea, this concerns me, and I know this is not in your field, but it seems to me, and I always think of this as concentration camps in Germany, where selected populations were put in dire straits and end up dying. I'm looking at this as we go into the future, because we're not even at the peak here in America, and we're looking at some really harsh times during the winter. I'm looking at this as maybe a case of genocide. Is there a legal case of genocide or something that can go to the United Nations? I don't know that ACLU is authorized to do anything like that, because it's obviously got parameters what y'all can do. But is this a case that needs to go somewhere else if we're not getting legal redress from a right-wing conservative court?
There are international tribunals that are concerned with issues of human rights. I am not an expert on the authority they have, although I've worked in coalition with people who've occasionally raised issues of mass incarceration to those tribunals, and we have a human rights program that does that, and I will follow up with them to get a better read on what our plans are. But I do just want to acknowledge what you've said, right? There are roots of eugenics running through a whole bunch of this administration's policies, and our mass incarceration practices are part and parcel of that approach. It's a racist and xenophobic approach, obviously. But when we look at what was done with family separation, when we look at what's done in our prisons, and frankly, when we look at the talking points coming out of many of these right-wing actors and policymakers, as though a public health crisis that disproportionately kills disabled people, older people, and Black and brown people is nothing to be concerned about. There's eugenics laced in all of that, and it's horrifying. So I don't directly know the lawsuit kind of mechanics for that, but I absolutely think we need to be frank about what's happening, and that there is the parallel in eugenics that you're describing, and it's just awful.
Lawrence, can you follow up with this? I mean, I know you're a professor, but you're not in the legal arena. But should something be done beyond the American judicial system about this?
Yeah, I'm in public health, and our modus operandi is prevention. So if there's genocidal violence, genocidal neglect that's taking place, we need to do everything we can to stop it, because like Andrea said, the court system and the legal process may take months, and somebody's going to die by the time that takes place. And so we have an election in the next month. And I think that's really critical to get out of office anybody, Democrat or Republican, that's not paying attention to the science, the epidemiology. And I think people, you ask what we could do, I think folks should go in their local community. There's a tool called the US COVID Atlas. Look up your county, look up their county, and then understand, all right, if we have a hot spot, if we've had a hot spot and there's a correctional facility in our community, then we can reasonably make the assumption, given the data that Andrea mentioned, that the two are linked. And we need to make sure that there's public health protocols in place. So that means our public health officials, my field, actually needs to be doing a much better job. And I think public health has utterly failed. The CDC is a joke. The CDC head was appointed by President Trump, and he's been utterly incompetent. They messed up the testing scheme. They messed up having the personal protection equipment. The doctors didn't even have the PPE. The nurses didn't even have the PPE. So if they didn't have it, then you know the prisoners didn't have it, because they're rendered and considered last in line. So we're talking about an incompetent government response to the pandemic, both inside and outside of incarcerated spaces. This is a president that's just contracted COVID, as we all know, and the White House is a hot spot for COVID right now. If they can't even keep the White House clean, then what do we think they're doing as it relates to our incarcerated friends that are inside these institutions? So I think we need new leadership that takes the COVID epidemic seriously, pandemic seriously, and that means public health officials and government officials being in place to follow the science and ensure that people are not exposed to this deadly pathogen.
Okay, one last question, and this is probably for both of y'all. I mean, we got a lot of hope, pending on the outcome of the election. Heavens forbid that it should be that we should end up with 4 more years of someone that might be insane. Where do we go if that's the case? Where do we go if we don't solve this electoral? What happens with 2.3 million prisoners stuck behind those walls? That's the question for both of y'all. Where do we go?
Well, I think for me, there's more elections that are taking place right now. So you got to look at your state, your local, the county governors or government, as I talked about earlier. That's where the county health officials are. That's where you have at the state level, they have a state health, public health department as well. So, I mean, so election or not, the thing is, like, put pressure on your local and state officials to actually follow the science and ensure the safety of incarcerated people is being upheld. And I think that means making sure we have to engage in a level of advocacy at that level, not just at the federal level. Although, of course, federal prisoners are going to be more so under the purview of federal judges, federal courts, and that things. But there are also state prisons, local prisons. So I think we have to, every avenue that we can take, we need to take that avenue and appeal to every official at every level that is actually applicable in the situation.
I agree with that. And just to name a few more of those local officials who will have great influence, your local DA, your local sheriff, and all of the local judges who do things like set bail and sentence people. They have tremendous power. And in fact, most of our mass incarceration occurs in counties and state facilities all across the country. There are overwhelming number of people in local facilities. So, and obviously constituents can have an even greater influence there, right? Because you're a bigger share of who those officials are accountable to. So learn what their policies are, find out where they meet. There's a great story the Marshall Project ran about a community organizer in Texas who just found her sheriff and made him get a burger with her, and then they started up a dialogue. Like, that's someone you can actually access, and they have a lot of power and control and accountability to not only addressing this crisis behind bars, but in the whole community, because as we noted, they're related. I just wanted to give one quick example of that exact issue because Professor Brown spoke to it so well. Just this week in Memphis, Tennessee, where I'm litigating one of these cases, a confirmed COVID-19 death occurred from a man who had been in the county jail. And on the news page saying, we've had this man has died of COVID-19 and he was incarcerated at the time he contracted it. The banner at the headline said, and restaurants are going to be open longer, right? The total disconnect that public health and jail health are the same. We absolutely need to recognize the interconnectedness.
Okay, thanks for joining me. And after the election, we'll revisit this again, and hopefully we'll have a way forward. Thank you.
Thank you so much.
Thank you.
And thank you for joining this episode of Rattling the Bars.